Muscles of arm. So in this category, I am going to discuss the muscles of the anterior aspect of the arm. That is, the three muscles are included. They are brachialis, biceps brachii and coracobrachialis. We have got one muscle which is having three heads: medial head, the lateral head and the long head, that is the triceps brachii muscle on the posterior aspect of the arm. So let's discuss that. So firstly, let's discuss the muscles of anterior aspect of the arm. So I would like to show you this muscles. So these are the muscles. So in this category, I am going to discuss three muscles. The brachialis muscle, a strong flexor of the elbow joint. We have got the biceps brachii muscle having short head and that of the long head. We have got the third one, that is coracobrachialis. So generally, we memorize the name of the muscles of anterior aspect of the arm by the mnemonic BBC. We know that this is a channel, BBC. B stands for biceps brachii, another B stands for brachialis and C stands for coracobrachialis muscle. Let's discuss the individual muscle. Biceps brachii muscle. So firstly, I would like to explain and then I would like to write the nerve supply and action and attachments too. So let me just enlarge this diagram. So yes, when I am enlarging it, you can see here this muscle is having two heads. So this is the coracoid process and this is the one head which you are seeing and this is the another head. So this biceps brachii muscle is having this belly, as you can see in this diagram. This is the biceps brachii muscle. Now here we have got two heads. This is the short head. This is the short head which you are seeing and this is the long head which you are seeing. Okay, this is the long head which you are seeing and this is the short head. So here, if I talk about the short head of the biceps brachii muscle, the short head of biceps brachii muscle arises from coracoid process of scapula. As you can see in the diagram that it is arising from coracoid process of scapula. Now, what about the long head of the biceps brachii? In this diagram, you can appreciate the long head of biceps brachii is arising from supraglenoid tubercle of scapula. Now, let's focus on to the insertion. So, when I talk about I for insertion, you can see here, so it's tendon, it's a biceps brachii tendon is inserting onto the radial tuberosity posterior part and on medial side it is slightly expanded, as you can see in this diagram. So that expansion is called as bicipital aponeurosis. So write down insertion. This is all about the origin and let's talk about the insertion. When I talk about the insertion, it's tendon, biceps brachii tendon inserts on radial tuberosity, where it inserts into the radial tuberosity. To be more specific, it inserts into the rough part of radial tuberosity. It inserts into the rough part of the radial tuberosity and immediately it is forming an aponeurosis which attaches to the ulna, that is called as bicipital aponeurosis. Medially, it is forming bicipital aponeurosis. This bicipital aponeurosis is covering median nerve and brachial artery at the level of cubital region. Now, so we have done with origin insertion. Let's talk about the action and the nerve supply. Okay, so again, I would like to slightly enlarge this diagram. So we have already talked about the attachment, biceps brachii muscle, which is having a belly and it is having two heads. This is an important muscle of the anterior aspect of the arm and all the muscles of anterior aspect of the arm, that is BBC, has got a common nerve supply. The nerve of anterior compartment of the arm is musculocutaneous nerve. So nerve supply is musculocutaneous nerve. Musculocutaneous nerve is the branch of lateral cord of brachial plexus having the root value C5, C6 and C7. Action. The action of biceps brachii muscle is, it's an important muscle which is also causing the action of supination. It is causing the action of supination of the forearm when the elbow is flexed. When the elbow is flexed, in flexed elbow. It is causing, it's an important muscle which is causing flexion of elbow in when the elbow is extended. When the elbow is extended, it is an important muscle causing flexion of elbow. So that means this muscle is causing supination of forearm. It's when the elbow is flexed, it is a supinator of forearm, and when the elbow is flexed, when the elbow is extended, it is causing flexion of the elbow. So these are two important actions of biceps brachii muscle. The nerve supply is musculocutaneous. Now let's discuss the next muscle. The next muscle of the anterior aspect of arm is coracobrachialis muscle. So in this diagram, again you can see here, this is the coracoid process of scapula. So this is which process? This process which you are seeing is the coracoid process of scapula. So from the coracoid process of the scapula tip, the coracobrachialis muscle originates, and you can see it is attached onto the humerus bone. To be more specific, it is attached onto the middle 1/3 of the humerus bone. So this is about origin and insertion of coracobrachialis muscle. Origin is from coracoid process of scapula. From the coracoid process of scapula. Insertion is on the middle 1/3 of the humerus, medial aspect. Now coming to its nerve supply and action. As it is the muscle of anterior aspect of the arm, so the nerve supply will be the nerve of anterior compartment of arm. Which nerve is this? This is musculocutaneous nerve.